Hi, this is Dr. Habash. I'm a cardiac electrophysiologist, and I'm here to go over your procedure with you. This is the EP lab, or the electrophysiology lab, and this is where we do our ablations. You're currently on the bed that you will be staying over it during the whole procedure. And as you can see, we have multiple monitors around the room and multiple equipment to help me do this procedure. To your left, this is the main monitor that I use to perform the procedure. Behind you to your left is the ultrasound machine, which I use to get access to the veins in your leg without having bleeding issues. Behind you to the right is the anesthesia machine, where an anesthesiologist will be taking care of you throughout the procedure and will maintain your breathing until you are awake from the procedure. And that's if you are under general anesthetic. If you're not under general anesthetic and we're using moderate sedation, then I'll be taking care of the sedation in addition to my nurses who will be making sure that you're comfortable. Over here is the table where we will have our equipment that I will use for the procedure. Across the room, we have many monitors that we use for pacing or for inducing arrhythmias. That is behind that TV. We have extra monitors over here and extra monitors behind me. The way that the procedure goes is that once you are comfortable and once your breathing is stable, we will start the procedure. We will cover you with sterile draping, and someone to my right will be helping me to start the procedure. I'll begin by having some numbing medication to your right groin, and this is where I will access the femoral vein. That femoral vein, I'll be able to pass through it a catheter or a wire, and that wire is connected to our system that will show me the data that I need. Once the catheters are in your heart, then I'll be able to study and figure out where those extra beats or the arrhythmias are coming from. And once I am comfortable and sure of the locations, then I'll start ablating. Ablation is basically using heat energy to take care of those extra beats. And after I'm done with my ablation, then this is the time for me to test my work. And at that point, I will pace your heart faster, or I will try to get your heart into faster rhythms to see if the ablation worked or not. If I don't see any arrhythmias happening, then we'll declare victory, and this means that the ablation that we have done is enough. But if I see other rhythms show up, then it means that I need to do more. After I am happy with the results of the procedure, then this is the time where we complete the procedure. Since you've had access in your groin, I will use some collagen plugs, which will make sure that you don't bleed after the procedure. Without those collagen plugs, you would have to stay 6 hours flat or 8 hours flat. But those collagen plugs will allow us to have you laying flat for 2 to 4 hours and be able to go home same day without the risk of bleeding. And after I do that, we will wake you up, and after that, you will go back to the area where you will recover.
Are you back? Good.
I have 5 to 6 people helping me in this room to take care of everything, between nurses and technicians. I have nurses sitting back in the control room monitoring your vitals, and I have all the equipment that I need to perform this procedure. Once I'm done with the procedure, I'll go speak to your family or call them as you request, and I'll be able to see you after you're fully awake.
Good work.
I'm looking forward to the procedure, and good luck. Have a good day.
Thank you.